Here at DeLong Family Chiropractic, we're always trying to get to the root cause of your health issues, whether that's back pain, stress, muscle tension. And Chris has been dealing with some on and off lower back issues that we've been working on. Now, he's a past athlete and he's had some issues and some injuries, but he's also an active adult. He loves to golf, he loves to play with his kids, play basketball, and sometimes issues happen and things start to get out of alignment and it can cause some problems. And so we've been working really well with trying to correct his misalignments to make sure that his spine, his back is strong and stable and able to handle all the things that he wants to do. So Chris has one of the really more common type of misalignments in his lower back. He has a loss of this lordotic curve, and as that spine starts to go straight, it can really create a lot of weakness in the spine, especially when it comes to the discs. When you lose that curve, it adds a lot of compressive weight, which can increase the risk of disc issues, disc herniations, slip discs. And so we want to make sure that we're starting to restore that lower back curve to make sure his spine is strong and stable. One of the ways that we're able to do that is using this arthrostem. Now, some people like the more manual type adjustments, and Chris is one of them, but some people don't like manual adjustments, but this is one of the best tools to help actually restore that curve in the lower back. So we're going to come right in here and work on getting pressure off that lower back. Good, just like that. Chris also really likes this manual style adjustment in his lower back. It tends to get a lot of relief and it allows him to feel better and get back to being active. And so we're going to get right into this lower back part of the lumbar, this L5, and we're going to do some light stretches and then good, just like that. So we're going to check for some counter rotation. He does have a little bit of rotation in his right pelvic, so more like the SI joint right here. And so we're going to do, again, a slight stretch. Relax that out. Good. Good job. Okay, on your back. He also gets a lot of tightness in his upper thoracic spine. A lot of physical activity. He's been in the construction world for a long time, and so we're going to really work on getting some extension in through his mid and upper back. So take a nice deep breath in. Relax it all the way out. Good. Good. Right there. Nice. Good job. So this is a manual traction adjustment, and this is absolutely not for everybody, but some people like it, especially Chris. This is one of the best adjustments to get some really good mobilization, get the spine loose and into good alignment. So we're going to put this on underneath his chin. Good, tighten that. And then we're going to do some nice, easy stretches, really trying to pump nutrients back into those discs, warm up the muscles and ligaments. So we're doing these nice, light, easy stretches. Good. Big breath in, all the way out. Good. Good. Nice. Now, being a past athlete and playing sports like football, he does have some issues in his neck. He doesn't really get a lot of symptomatology in his neck, but because we're trying to correct the spine and to remove any areas of damage that could even eventually create issues, we're going to be adjusting different areas where he's had some traumas in his neck. Even though there's not a lot of symptomatology, we just want him to never get issues and stay healthy and stay active for as long as possible. So, good. So we can feel that right there. Good. So we're going to do a little lateral stretch. Good. Let it go. Nice. And right there in that lower part of the neck. Had some stresses? A lot of hard work, huh?
Lots of it.
Okay, we're going to relax it. Good. Nice.
Yes.
Good job. One of the things that we're going to specifically do with making sure that his spine is healthy and strong is make sure that we have a really good curve in the neck. Just like we have to have that curve in the lower back to make sure we can, exercise and play and lift and bend and make sure those joints are healthy and strong, because we have to have that lumbar curve. We also have to make sure we have a really good curve in the neck. And so we're going to be using the arthrostem to help with creating that healthy curve right there. Good. So Chris has done really, really well with his adjustment processes. He's done great with getting some structural correction. He's gone through a couple different corrective protocols. But Chris, what do you feel like has been maybe the biggest difference since you've been getting adjusted?
Lack of headaches. Used to have headaches during the day, a lot of brain fatigue, especially in the afternoon. So I've set up my adjustments to try to come in before noon, and I haven't seen that problem at all. And then just the mobility, just to be able to go out and play sports again, be able to go out and play basketball has just been awesome.
So one of the most important things when it comes to getting structural correction is the spinal rehab. So before they get adjusted, they do some very specific spinal warm-ups where they'll do repetitive cervical traction to really help warm up the muscles and the ligaments in their neck, rehydrating those discs to restore or to stop that degenerative process, but to actually restore some disc hydration. After their adjustment, they do some additional rehab exercises where they really work to strengthen and stabilize that correction, really helping them hold their adjustment and allowing it to last longer. So if you're suffering or in pain, or you're just curious if we can get to the root cause of your health issue instead of trying to take more drugs or end up having surgery, take advantage of our new patient special. Schedule your consultation. We'd love to sit down and really figure out if what you have going on is something that we can help with. So we'd love to figure out if we can help get to the root cause of your problem and get you well and avoid drugs or surgery. So take advantage of that new patient special. We'll see you soon.